Wednesday, and that means it's time for Healthy Living. Today, Megan Bland joins us from the Vigo County Health Department to talk about two topics. First, we're going to talk about the West Nile virus, and then we're going to talk about tick-borne disease prevention.
Correct.
It's hard to believe that it's that time of the year already.
It is. It's went by really fast.
So let's talk first a little bit about what's in this jar, because
Sure.
it's definitely intriguing everybody, especially Mr. David Wire. He definitely is intrigued by this. Tell us what's in this jar.
This is actually mosquito larvae.
Mosquito larvae,
Mosquito
okay.
larvae. And this is what happens when we don't check our property, if we leave water that's outside that's went stagnant. And this is actually the water that can collect in the ditches, along the county roads and that kind of a thing. So this is what happens. The mosquito lays her eggs in the standing water, and then the eggs will actually hatch, and it turns into this larvae.
And there are a lot of them in there.
There are, and this is just a small sample that we took. And these will they will end up developing into full-grown mosquitoes. So that's why it's really, really important to check your property for standing water.
And then that in turn could lead to West Nile virus.
That's correct.
So for people who may not know about West Nile virus, kind of tell us a little bit about it.
Sure. Well, it's a mosquito-borne virus that occurs when a mosquito bites an infected bird. Those mosquitoes can then, in turn, bite humans and pass the virus on to us and also animals like cats, dogs, and horses. And basically, a lot of times people have really mild symptoms. Sometimes they might not show any, and then other times they have really severe symptoms that might lead to hospitalization. So symptoms are going to include flu-like symptoms, illness, rash, maybe on the trunk of the body, a fever, fatigue, that kind of a thing. It's really serious in people over the age of 50 is where it typically strikes the worst at. So it's always good to kind of just be aware when you're outside and kind of take in mind some precautions.
And so we talked about one precaution is to make sure that you don't have any standing water. What else should we do?
Well, the next best thing, if you have to be outside, is to wear bug spray that contains DEET, which we brought some examples here. Spray yourself down really good with that. If you can, wear some light colored clothing. That way you can see if you have a mosquito on you. And really try to avoid going outside from dusk to dawn. Those are the prime biting hours for mosquitoes. Also, like I said, make sure you dump any standing water out, change the water frequently in bird baths and dog dishes. And then also, if you're going to have your windows open, make sure they have screens in them that don't have any types of holes or anything like that.
And real quickly, we are in the height of tick season.
We are, and they are really bad this year. Tick season usually occurs April, May, and June, so we're right in the middle there. And with ticks, it's basically the same precautions as West Nile virus is with the mosquitoes. You want to make sure you apply bug spray with DEET if you have to go outside. Make sure you wear shoes that cover your entire foot. And also, if you're going to be out there, you really need to tuck your pant legs into your socks because they will crawl up your legs, unfortunately. The big disease with ticks is Lyme disease that we're concerned about. And with Lyme disease, you generally develop a fever, and then you get a really well-known rash. It looks like a target. It's a red circle, and it has a white center in the middle. So if you develop that, you need to call your doctor right away.
Alrighty, well, thank you so much, Megan. We appreciate it. Thank you. Again, our Healthy Living segment airs right here on Wednesdays. If you'd like more information on healthy living, check out our website at WTHI-TV.com. News at midday. We'll be right back.